My name is Marissa Wilson. Here is my student ID. And then I'm going to do a 360 of the room. Hi, my name is Marissa Wilson, and I'm going to be conducting an abdominal assessment on you today. Okay. First, I'm going to just look at your abdomen. You can either keep your hands folded on your chest like that or at um, your sides, okay? Okay. I'm just going to take a look. Abdomen appears symmetric bilaterally. The umbilicus is midline and there is no bulges present. Um, Skin issues wise, there's no scars or rashes or lesions. There is some striae bilaterally on the lower portions of the abdomen. There is no aortic pulsations or visible peristalsis. And then his contour is a little rounded, but there is no like scaphoid or protuberance. Next, I am just going to listen to your abdomen, okay? I'm going to use the diaphragm, which is the bigger part of the stethoscope, to listen to your bowel sounds. Your bowel sounds were normal active, which means that they are making the appropriate amount of bowel noises. Next, I'm going to listen with my diaphragm over the liver and the spleen for what's called friction rubs. And then I'm going to listen over the spleen, sorry. Okay, no friction rubs heard at the liver or the spleen. Next, I'm just going to listen for some bruise over the aortic, renal, iliac, and femoral arteries, okay? I'm going to listen to these also with the bell of my stethoscope, which is the smaller part. First, I'm going to listen at the aortic, sorry. Next, the renal. Then the iliac. And lastly, the femoral arteries. I didn't hear any bruise in any of the locations. Next, I'm going to listen for what's called venous hums around the epigastric area and then right over your umbilicus, okay? Again, using the bell of my stethoscope. Okay, no venous hums were heard, which is normal. Next, I'm going to do what's called percussion, where I listen basically to the sounds of your abdomen for tympany or dullness. Okay. No sounds of dullness. It was all tympanic throughout the 9 areas. Next, I'm going to percuss to find how much the span of your liver. The normal span of liver is between 6 to 12 centimeters. Okay, so I'm going to have you put your arms to your sides. I'm going to start up here and then percuss downwards until I hear dullness, and that'll be the top or of the liver's edge. And then I'm going to start and do bottom up till I find the edge of your liver. I'm going to measure that real quickly. Okay, and it is 6 centimeters, which is normal. Next, I'm going to do the same thing, but I'm going to percuss over for the spleen to see if you have any splenic enlargement. Okay, I'm going to have you take a deep breath and hold it. Okay, go ahead. You can relax. I'm going to do it one more time. Okay. Okay, take a deep breath. No. Um, Tiffany was heard, so you didn't have any dullness for splenic enlargement. Next, I'm going to do what's called palpation, where basically I push in on your abdomen. If at any point you feel any pain or tenderness, let me know. First, I'm just going to do some light palpation. Okay. Any pain or tenderness? Okay. Next, it's called deep palpation, so I'm going to go a little bit deeper. Any pain or tenderness? No. Okay. Next, I'm just going to palpate the liver's edge. I'm going to do what's called the hooking technique. So I'm going to put my fingers underneath your rib cage here, and I'm going to have you take a deep breath in. Okay, and let it out. Okay, the edge of the liver was felt slightly. I'm going to palpate for your splenic edge. I'm going to put my hand under you here, and you just relax, but I'm going to support you. And then I'm going to have you take a deep breath in. Breath in. Okay, and you can let it out. And do it one more time. And let it out. Okay. I did not feel the splenic edge, which is normal. If I felt the splenic edge, it would mean that you had an enlarged spleen, which I do not feel. Okay. Next, I'm just going to support you again, but I'm going to feel for your kidneys. Okay, so it's going to be a little bit deeper. Okay, I'm going to do the same thing on the other side. Sorry. Okay. I was not able to palpate either kidney, which is normal. Next, there is no ascites present just from inspection. I wouldn't do a fluid shift assessment because when I percussed, majority of the sounds were tympanic, so it would be hard to do a fluid shift for tympany and dullness because there's no signs of ascites being present. Next, I'm just going to assess for appendicitis if you want to uncross your legs. First, I'm going to do what's called the Rovsing sign, and I'm going to apply left-sided pressure, and you tell me if you feel any pain on the right side, okay? Any pain on the right side?
No.
Okay, the Rovsing sign is negative. Next, I'm going to raise your right leg, and you tell me if you feel any pain anywhere in your abdomen. Okay. Any pain in your lower part of your abdomen?
No.
Okay. And then while you're up here, I'm going to have you bend your knee and I'm going to rotate your leg. Rotate this part in out. This is called the overture sign. Do you feel any pain in your lower abdomen? Okay. Both signs were negative. Next, I'm going to assess for cholecystitis, which is inflammation of the gallbladder. Okay. This assessment is called the Murphy's sign. So I'm going to palpate the liver's edge and I'm going to have you take a deep breath in. Okay. Take a deep breath for me. You can let it out. If for some reason you had an inflamed gallbladder while taking a deep breath in, you would have extreme pain and you would not be able to hold it. Okay. Last assessment is called CVA tenderness. So I'm going to have you sit up somehow. This is just to assess your kidneys. Okay. So I'm going to come back here, find the edge of your kidney, and I'm going to strike. Any pain?
No.
I'm going to do the same thing on the other side. Any pain?
No.
Okay, your CVA tenderness was negative, so you don't have any kidney issues either or kidney inflammation.
Okay.
All right, thank you.